Hi, it's Mark Bossert from Top Local Lead Generation. We're here today with Dr. Nicholas Jensen from Divine Elements in Vancouver. How are you doing today, Dr. Nicholas?
Great, Mark. Thanks for having me. Good to see you.
So we're going to be talking about how to support your adrenal health. So I guess let's start with the basics. What are your adrenals?
Yeah, well, since we talked about the thyroid last week, we can't talk about the thyroid gland without talking about the adrenals. So the adrenals, we've got two of them. They sit on top of both of our kidneys, and they're responsible for releasing over 50 different hormones. So most notably, the hormones that, or I guess most notably the secretions that they release are responsible for controlling inflammation, regulating heart rate and blood pressure, helping to support or enhance the fight or flight or the stress response. So we often talk about these adrenal glands in relation typically to cortisol and DHEA. So cortisol is our main stress hormone or catabolic or breakdown hormone, and then DHEA is one of our main anabolic hormones. So these are the main systems that are working in the body.
So they sound pretty important. What do we do with that information?
Mm-hmm. Yeah, they're definitely important, and they're often overlooked in the mainstream medical system. So the reality is that this is definitely an area for naturopathic doctors and functional medicine doctors to address for patients. So these symptoms can look anything like someone experiencing chronic low mood or low energy, all the way up to autoimmune conditions to low libido. So the sad reality is that if these symptoms are present, most notable or the most common prescription is going to be, again, same old stories, an antidepressant for suppressing those symptoms that are showing up. So as a naturopathic doctor, our role is to get to the root cause of why things are happening. And these symptoms are long and many, but they can include a more increased response for allergies, skin conditions, like I said before, autoimmune, low libido, increased inefficiency at regulating blood sugar. So there's usually a weight management control problem that shows up with this as well. There's basically too many symptoms to list, but the biggest one is definitely fatigue and just having a poor coping mechanism to stress on a day-to-day basis.
Okay, so probably like most people, I have some of those issues. So what are we going to do about it?
Yeah, and I mean, you're definitely not alone. We just, like we said a couple weeks ago, just had our second child, so we're feeling the adrenal fatigue big time, and our main cause is obviously lack of sleep. So yes, most people do have adrenal fatigue, and recognizing the underlying reason is definitely the most important piece. So, and because it is such a common issue for so many people, it's something that's often overlooked and needs to be addressed. So, what we do in the clinic, in the True Balance program that we've been speaking about over the last few weeks, is for people who are experiencing these kind of symptoms, we often recommend running a 24-hour urine test, which measures these cortisol DHEA levels in the urine, and it also measures the breakdown products or the metabolites of these hormones. So we can get very, very clear and very specific about how these hormones are presenting in someone's body, and then administer therapies to target those imbalances very specifically. It's also quite interesting that often when people are struggling with their hormonal system and the adrenal glands and or the thyroid gland have not been addressed, then a lot of times people only get so far in their bioidentical hormone program. So sometimes we need to take that extra step and really address and get to the bottom of how the adrenal system is working, because that will really determine your ability to create long-term health.
So what do you mean, like, if somebody started on the more like the testosterone or the whatever the female hormone type, kind of what you would normally think of as bioidentical hormone treatment, that perhaps they haven't had it in the DHEA supplementation or the adrenal supplementation and thyroid stuff that they need? Is that what you're?
Yeah, essentially when we every time we do our True Balance program, what we're doing is looking at the core hormones. So we're looking at testosterone, progesterone, DHEA, estrogen. When we get that picture balanced and we basically the blood levels are looking great and symptoms are improving, but we're not getting to where we know we could get to. That's often where the thyroid and the adrenal system need a little more attention. So it just it helps us kind of filter out part of the problem and get closer to an underlying issue that, in reality, the adrenal system is usually something that's been off for quite a few years through our lifestyle practices. You know, we're people that are eating too fast, eating fast food, are racing from one job to the next, and we're flying by the seat of our pants most of the time, unfortunately. And our minds are racing much faster than our bodies. So the reality is that we've become more toxic. We're living fast-paced lives, and we're burning ourselves out. So what the core hormones do is decrease inflammation, support that the metabolic pathways in the body, and protect the nervous system from degenerating down the road. And what the adrenal system and thyroid system is basically tighten up that picture and bring together that extra support that maybe is missing.
So I guess for most of us, probably caffeine is sort of our major go-to. This is how I can feel better and keep going,
Yeah.
kind of thing. And what kind of effect does caffeine have on the adrenal system?
Yeah, that's such a good question. Caffeine is, I mean, there's very few people that aren't using caffeine to help get them going through the day, and it's such a common piece. It's so accepted to use caffeine, and the way I encourage patients to look at it is that this is a drug. It's something that's stimulating your brain, and it should be used wisely, just like any other medication. So what we say is just don't overdo it typically, but caffeine essentially is causing a surge in cortisol in your adrenal glands. Caffeine lingers in the body for over 8 hours in the system. That's its half-life. So that means it takes roughly 16 hours for your body to process. And I mean, if you want to get more scientific about it, it actually stimulates the same receptor sites as cocaine does in the brain. So it's a huge excitatory neurotransmitter in the brain. So it can be really detrimental using caffeine technically as a medication significantly throughout the day. Having more than 3 or 4 cups a day would be detrimental to adrenal health. Essentially, that's just going to put us into a burnout stage, and recovery gets a little more challenging. So that would definitely be part of addressing an adrenal program. Thanks for bringing that up. That's an important piece.
Well, I just know that. So I mean, look at our culture. I mean, there's 200 just in downtown Vancouver alone.
Yeah.
There's 200 plus coffee shops, right? Yeah. So it's obvious that we're all cranking as much coffee into us to keep going, and it's a common joke. I'm gonna IV the stuff. Well,
totally, yeah.
Except, what's the long-term consequence of doing stuff like that?
Yeah. I mean, when you look at it like that, it's no different than chronic sleep deprivation. If you take a look at yourself when you haven't been, well, I mean, rewind back to when you were having kids and not getting that sleep, your mind isn't as sharp, you're feeling low energy, you could, punch any person that you see that rubs you the wrong way, and we just have no capacity to handle stress, and that's because, you're sleep deprived. Well, caffeine does it in the opposite.
We've lost Dr. Nick. The wonders of the internet have failed us. So we're going to wrap it up right now. Perhaps we'll start this again or do another one about this subject. It's a really important subject. We've been talking with Dr. Nicholas Jensen from divineelements.ca. You can give them a call at 604-568-3735. Talk to you folks later.